Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm an inventor of ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headache, pain and fatigue before I invented ASTR specialty. Right, Kelly, tell me what's going on with your neck, what happened?
In the past, I had disc bulges in my neck from a car accident. And
How long?
about 8 years ago.
Okay.
So it's been off and on, constant pain in my neck, pressure in my right arm.
For 10 years?
Yes.
Okay.
Yes, 8 years. I think it's been about 8 years.
8 years, okay.
Yes, on and off. And most of the time I'm pain-free, but then it tends to flare up.
Okay.
And then when it flares up like it is now,
Okay.
my pain can be anywhere from a 6 to an 8.
Oh, okay.
Range of motion is limited, activities are very limited, and it's just constant pain.
So, you said been like 8 years on and off. The recent episode, how long has been going on and what happened?
Lifting some boxes in December,
Okay.
I twisted my back, and then a few weeks after that I could start to feel it in my neck as well.
Okay.
So for the last 3 months it's been building.
Okay.
Little discomfort,
Yeah.
little discomfort, and now it's just full-blown, a lot of pain.
Okay, so how you describe your pain? Is it dull, sharp, aching? How much from 0 to 10 to?
In my right arm, it's I would say close to an 8 now.
Where?
It's mostly right here.
Okay.
It aches constantly. It's a dull, aching pain. When I use my arm, it can be sharp.
Okay.
When I turn my neck, especially to the right, I'll get sharp pains in my neck.
When you move your arm more, do you feel the sharp pain in the neck or your shoulder, your arm or shoulder?
Usually kind of in the neck, towards the side of the neck. But I do also start feeling it down my arm as well.
So, did you have any treatment recently, and what kind of treatment?
In December, I had physical therapy,
Okay.
which focused mostly on my lower back at the
Okay.
time, and it just didn't work. I went for a week, and it brought me no relief.
What other treatment you had?
Injections, which worked for like 2 days maybe, and then the pain was back.
What kind of injections?
It was mostly for muscle spasms and for pain.
It was trigger point injection or something
Yes,
like that?
yes,
Okay.
that's what it was, the trigger.
Okay.
And it just, at the time it felt fine, and the next day, but then it wore off.
What other symptoms do you have? Do you get headaches, nauseous, or anything?
Not nauseous, I'll get headaches sometimes. It's mostly just the pain.
Do you have headache right now?
No, I do
Okay.
not right now.
Alright, so I want to see your range of motion, turn your head left and right, and tell me how much pain.
Okay, that's 0.
Let's do the movement without moving your trunk, it's just your neck only,
Okay.
because you're compensating.
Okay, that's
Very
0.
stiff, very slow.
Okay, that's 3, 4.
You're very stiff.
Yes.
Okay. So that's since December. We are in the beginning of our April, so it's a little bit over 3 months. Extend.
And that really hurts. That's like a 5. And that pain shoots all the way down here.
Yeah. Okay.
And,
So it's worse with the extension.
Yes. And that's maybe a 3, and I feel it up here.
Okay, side bend left and right.
That's okay.
So you said bulging disc 3. Do you know which levels?
Yes, my 3rd, 4th, and 5th vertebrae were bulged at 4, 5, and 6%.
Oh, okay.
Does that make sense?
Yeah. So let me see your shoulder range of motion and tell me if that causes any pain.
That doesn't cause any pain.
Okay, thumb up like this. And bring it up toward the ceiling.
A little.
So your neck is the one causing the pain?
Yes.
Let's bring it back this way.
I can feel it about a 2, it starts to pull. The same thing.
Okay.
2 and it pulls.
Okay. So you've been stiff like this since December?
It's gotten worse the last few weeks.
Mm-hmm.
I mean, I could even feel it getting more stiff.
Mm-hmm. Is that painful what I'm doing?
No, that's not.
So a sign of the inflammation is swelling, redness, sensitive to touch. You will feel like tenderness. Let's see how this feel.
Good.
Is not painful like the other one?
No.
Okay.
Feels good.
Okay. That's good. So I have special magnet. It's called MagnaHeal.
Mm-hmm.
I'm gonna try to desensitize this area.
Okay.
So to see if I will be able to really go deep to that knot.
Okay. Okay.
If you have like mild inflammation, you're gonna feel better after the MagnaHeal, and I can dig in.
Okay.
If you have really moderate to severe inflammation, we'll probably need to do the MagnaHeal several
Okay.
for longer time.
Okay.
Try this now. How's this?
It's okay.
Mm-hmm. What about now?
It's okay.
Here?
A little sore.
No, so okay. Let me. No seizure. You don't have any seizures or
No,
pacemaker or
seizures.
anything?
No.
Okay.
No.
So this is a MagnaHeal,
Okay.
and it's I coat it with anti-inflammatory ingredients
Okay.
just to see if I can desensitize this area. But this is a big knot. Like visually, you can see your trap is sticking out. I don't know. Can you see that?
Weird.
Mm-hmm. Can you see it? It's
Slightly. You can
Yep.
see that it's red.
Yep, it's a little bit red, so I'm gonna desensitize this. And you said your herniation is in here. Is that too much?
No.
Keep your head up. Yeah, extension was an issue with you, so we're gonna use that for reassessment after the treatment
Okay.
to see how much, how can you move it afterwards.
Okay.
Okay. How's that?
That's okay.
Okay, so it's not too bad.
Yeah.
I'm
that's
actually
okay.
doing the same pressure I did before.
Okay.
I'm actually going further, so this way to trying to release that big knot. So when you have injury, you said you lifted boxes.
Mm-hmm.
You probably strain your neck and your traps here.
Okay.
When you do that, it's kind of like getting micro tear in the muscle.
Okay.
So your body has to build the scar tissue to heal.
Okay.
If your body does not build the scar tissue, it's permanent tear.
Okay.
We need the scar tissue. Excuse me.
Mm-hmm.
The problem is when you have too much scar tissue, it's in the way of everything.
Okay.
In normal scenario, the body should get rid of the scar tissue by itself, moving from inflammation, proliferation to maturation stage. But when the body does not dissolve it, and you have injury over injury, you start to have that like 40 layers or 50 layers of scar tissue,
Mm-hmm.
and you feel that knot, rock.
Yeah. Okay.
And when that happens, instead of your muscle stretch like this, like a rubber band, it's like you have a knot in the muscle. So when the muscle stretch, it does not go further. And the classic presentation of that, you don't have 4 inch of motion, you just...
Yeah. Okay.
And I think a part of your, look straight, your risk factor is the herniation, because that's your body, your neck start to spastic, like you start to have muscle spasm as a compensation because your body knows something wrong,
Mm-hmm.
just a protective mechanism, and that might cause more scar tissue. How's that?
That feels better.
Mm-hmm. Okay.
It's feeling better.
That's good. I feel better too.
I'm glad.
Okay. Is it too much or it's
No,
okay?
it's okay.
I can visually see the scar tissue sticking out here compared to the other side. This is totally down. This is sticking out. I don't know if you can see it. How easy you can see that. Sorry, I get lotion on your hair.
That's okay.
But you feel this bump here?
Yeah.
You feel that? That is a scar tissue. That's a
Really?
big bump.
Wow.
You should not have it like this. If you don't have a scar tissue, it should feel like this. You feel how nice and smooth?
Mhm.
Yep. This is not smooth. This is
Mhm.
just a piece of rock. Can
Wow.
you see it? It's just jumping here.
I can
That's
see it.
exactly.
Yeah, I can
Yeah.
see it.
And the other sign of scar tissue is we'll see more redness where is the scar tissue compared to everything around it. And you can see here, look. It's all skin color here, a little bit scar tissue here, a little bit here, but mostly in here, in this area. You feel this knot here.
Yeah. I feel that.
Yes,
Yep.
yes, you can.
Uh-huh.
Compared to this,
Uh-huh.
nothing. There's nothing here.
Yeah.
So that's a knot. But it is a little bit smaller than the opposite side. Can you tell the
Yes,
difference?
yes,
Yeah.
I can tell it's smaller. Is that scar tissue also?
Yep. Because
Okay.
anatomically you should not have this there. Your muscle should be nice and smooth like this.
Okay.
If you did not have any injury.
Okay.
How long you been having those knots, or you just realize it now?
The last few months I've noticed it more.
More.
Because I'll
The muscles
massage.
are spasming.
Yeah.
Yeah.
And I'll be like, that's
Did you have
interesting.
massage?
Yes, but it's been a while.
Okay. And
Yeah.
left and right.
I still feel like a little pull
Mhm.
when I turn to that,
Right.
to the right.
Mm-hmm.
A little bit still.
In that spot.
Yes.
Okay. So let's drink a little bit more water, and we'll have you lie on your back, head here. Make sure it's not painful, okay?
Okay. That's a little painful.
Sorry.
It's okay. That's sore right there.
On this spot, yeah.
Yeah.
But you have a scar tissue here. You feel that?
Yeah.
That's a knot here. That's
I
from your
can feel
posture,
that.
probably.
Yeah.
Okay. Let's sit up again, facing this way. If you never had ASTR treatment,
Mm-hmm.
you will find a lot of the scar tissue, like from past injury.
Mm-hmm.
You know, the patient that I treat and we release everything, we're going over to proper ergonomics and mechanics and stuff like that. They usually, when they come for other injury, that old scar tissue been resolved already. Does that make sense?
Mm-hmm.
But because you did not have that, you probably had injury here, bad posture here, bad lifting here, the herniation, the jerking movement from the accident. You got all the scar tissue, but your body has not been resolved, so that's why you have it all over.
Okay.
Does that make sense?
It does.
And you feel those grinding here.
Mm-hmm.
That's the scar tissue. Do you clench your teeth or grind? Lift your head up nice and tall.
Sometimes at night, yeah.
And that's what causes scar tissue in the occipital area here, temporal, and the maxillary. If you have jaw pain, just let me know, we'll work on it too, okay?
Okay.
Because that's usually common with grinding.
Okay.
Sorry, I just okay. So let's move your neck and tell me how that feels.
It feels much better.
And extend.
Still hurts right here.
How much from 0 to 10?
About a 2 to 3.
Right in that spot?
Yes.
Okay.
Right. Okay, right here.
We'll have you face this way.
Okay.
So I worked on the proliferation stage.
Okay.
Now I'm gonna focus on inflammation, okay?
Okay.
To get this inflamed area down under control. I'm actually gonna use 2 magnets. It's right in here, yeah?
Yes.
It's not in your neck?
It's right like,
Here too?
yeah.
I'm just using 2 magnets because when I use it, that's the range run from 4 to 5 inches.
Okay.
So I just want to make sure to go deep, okay?
Okay.
1 magnet is usually the range of the magnetic field, 2 inches to 2.5.
Okay. Definitely better range of motion.
What about extension?
Better.
Still feel it or it's gone?
You know what? Now I'm feeling.
You feel it in
Yeah.
there? I did not work on your shoulder. Okay.
Yeah.
So, but your neck is okay now?
But my neck feels much better.
Okay, so let's face it this way.
Yes, much better.
So it's your shoulder. So you injure your shoulder too. You said when you were lifting boxes?
Yes.
Okay, you feel it just in here?
Yeah, it goes
Uh-huh.
like down.
Okay.
Yeah.
Okay, relax, relax.
Okay.
Is that too much?
No.
Okay. You feel the tightness here? That's pulling your whole body. You see? I'm just pulling here and it's just pulling the whole body. That's a fascia tightness. Sorry,
That's
relax.
okay.
How's that?
That's good.
Okay, relax. Put some lotion on. Just get this over here. Here you go. You feel that scar tissue here?
Yes.
Yeah. It's right in here. Relax.
Okay.
There you go. So your pain actually exactly where the location of the scar tissue, did you notice that?
Yes.
Mostly.
Yes. Especially, yes. With the arm.
This is fine here. Yeah, a little bit, not too bad. Here a little bit, for that. Here. Tell me how that feels.
That feels better.
So move your arm and tell me how's your shoulder doing.
A lot better.
So it's gone from the shoulder?
Yes.
Okay, let's move your neck and tell me how does that feel.
Feels much better.
And extend, because that was the motion that I gave right. Can you see how far you can go now?
It feels much better.
Any pain or everything's okay?
No, no more pain.
Okay,
Yeah.
awesome. So
Yeah.
you had injection, you had physical therapy before.
Yes.
So can you tell the difference between ASTR and what you have? And what's the difference?
Definitely. Relief. I actually have relief.
That's good.
Yes.
Awesome. Thank you.
Thank you, doctor.
Thank you.
Thank you.
Feel free to subscribe to my channel to get helpful tips on how to relieve pain and watch real treatment videos. There are over 45 studies that support ASTR treatment model. If you are a patient and would like to schedule an appointment or treat yourself at home, check the link below. If you are a healthcare provider and would like to receive ASTR training and buy ASTR instrument, check the link below. See you soon!